Hi, welcome to OxyHealth's Fortius 420 operation video. Let's get into it. When approaching a chamber for a session, you want to make sure that your air in is open, which means the valve is parallel. You want to make sure your air out is closed so you can reach pressure, which means that this valve is perpendicular. Again, this is open and this is closed. These two valves, they also are mirrored inside the chamber. You want to make sure that those interior valves are also the same. The air in is open and the air out is closed. Now that we have our air in and air out valves and the correct configuration, let's go over to our pressure valves just above the door. These are all of the pressure valve settings that go from 1.3 to 2.2 atmospheres. We have a secondary air out vent that is all the way here on the right hand side. This also needs to be closed prior to that treatment. Let's talk about our pressures here. We have 1.3, which is 4.4 pounds per square inch. We have 1.5, which is 7.3 psi. We have 1.75, which is 11 psi. 2 atmospheres, which is 14.7 psi. And 2.2, which is 17.6. Now we're going to talk about selecting that specific pressure. Since they're all open and your vent is closed, 1.3 is going to hit first. To get to 1.5, you simply close 1.3, and now 1.5 will engage. Closing 1.5, you will reach 1.75. Closing 1.75, you will reach 2. And closing 2, you will reach 2.2 atmospheres. Now there is a second way to operate these valves. If all the valves were closed, including your vent, now you approach the chamber, and currently we're going to be doing 1.5 atmospheres. Open up 1.5 and you're ready to go. Now that we've selected the correct pressure threshold, 1.5 atmospheres, now we're ready to have the patient start their session. First is what we're going to do here. You're going to turn on your compressor. You could do it from the power switch or you could do it from your remote. Now that we have airflow coming into the chamber, we're ready for the patient. Hi, if we could just take our shoes off, please. Perfect. And then just mind the head. In this particular Fortius, we're featuring our chair and rail system, quite comfortable, making sure that the patient reclines ever so slightly, again, just to mind the head as they're sliding back. We do have an ottoman as well that is magnetized. That's on the side of the chamber, and that fits directly over our rail. And then now the patient is to place their grounding strap. They can do it on their wrist or they can do it on their ankle. Ready to go? All right, and now we close the door. From here, with your body weight, gently lean and pull the door and hold for approximately 10 seconds. Feel for the door, it's all sealed up. Now that the door has been sealed, we walk back over to our control panel so we can monitor the patient during the entire pressurization time. As the chamber is pressurizing, when the gauge starts to read 2 pounds per square inch is really where the ears start to feel the pressure building. This is our initial check on the patient to make sure that they're equalizing on their schedule. How are we doing in there?
I'm doing great, thank you.
Doing great, and that's great to hear. We can continue to reach pressure. If at any time that you need to slow down that pressurization process, if the patient is having some difficulty equalizing one ear, you can open up your air out vent. You're going to slow down that pressurization process. You don't want the needle to go up or down, to remain stagnant, and then as soon as the patient gives you that thumbs up that their ear is equalized, you then can close off your valve, continue to reach that pressure. If the patient is lying down flat supine, for some, that could be the challenge. Encourage them to sit up at a 90-degree angle, complete the Valsalva maneuver or move the jaw, and again, as soon as he gives you that thumbs up, close your valve back off and continue to reach that pressure. Once the chamber has reached its desired pressure, here as being 1.5 atmospheres, you're going to hear the valve fully engage. As soon as you hear that, that's when the treatment time starts. Then we can move on to our supplemental oxygen delivery. So now that the treatment time has begun, we're going to instruct the patient to put on their mask. But prior to that, we're going to turn on the oxygen from the bottle specifically. Hi there. You're able to put your mask on now.
Okay, thank you.
The reason why that we turn on the oxygen as soon as we reach pressure is to make sure that there's no oxygen that's building inside the chamber during that compression time, and it also saves on O2 costs for you as well. Now that we have reached pressure, the patient is breathing their supplemental oxygen at that desired flow rate, treatment time begins. Treatment time begins. We'll see you in 60 to 90 minutes. I'll be checking on you frequently. Make sure that you check on the patient frequently throughout that 60 to 90 minute session. Keep your walkie handy and attached to your person at all times so that way you can get to the chamber immediately. Now that our 60 to 90 minute session is completed, now comes the decompression protocol. First things first, we're going to take off our mask. Feel free to take off your mask now. Secondly, we're going to shut off the oxygen because again, the treatment is now complete. Third, we're now going to gently depressurize the chamber using it from the air out vent on the control panel, always making sure that you have constant eye contact and monitoring of the patient inside. Gently open your air out vent approximately halfway. Now you want to look at your PSI gauge. The decompression protocol is 1 minute per PSI. Essentially what you can do is you can count to 30 per half PSI, and if that matches, you know you're on track. During decompression, ensure that you leave on your air compressor. This ensures that you still have fresh air that's entering the chamber while you have more air that's escaping at the same time, and this also helps to reduce CO2 levels, especially when you're at a higher pressure threshold. Now that we have reached 2 pounds per square inch during our decompression protocol, we're going to check on the patient again. How are our ears doing? We doing okay in there?
My ears are doing fine. Thank you.
So we're doing okay here. So now that we're at that 2 pound per square inch, most of the ear popping has already stopped. We're going to open this up a little bit more gently. We're going to open that up all the way. So now this is all the way open on the air out vent on the control panel. Now, most of the ear popping has already stopped. We're going to shut off our air compressor. Now we're going to wait until it gets to about 1 pound per square inch. Now we can open up our vent above the door all the way. This is plug door technology. There's no lock. The door seals with pressure only. As soon as the pressure in the vessel alleviates, this door is automatically going to pop right open. I'll take that. And that is the completion of the Fortius 420 tutorial video by OxyHealth. We'll see you next time.